Hi, I'm Dr. Tim Meggs. Welcome to our podcast this week. This week, our show, I can't emphasize how critically important this is because the topic we talk about today is it's going to change lives. It hopefully is going to prevent injuries and change the course of the health pattern that younger athletes are on. It's a topic that needs to be discussed and is not discussed anywhere near enough. So please watch this and come away from it with maybe a newfound respect for how we should be taking care of our kids. To get there, I want to just give a brief history of kind of why I've gotten to where I am today. In 1994, after working with the New York Giants, we started the development of the structural management program. And it's just as it says, structural management. We think in terms of injuries, or the current system does, and I now think in terms of biomechanical faults because I know what they lead to. I have young athletes come in, I have elderly come in, and elderly are a result of biomechanical faults that no one ever talked to them about. So the structural management program is the program that we try to incorporate with everyone. People are so programmed by if it doesn't hurt, don't worry about it. But as I tell people, you will pay. You pay today or you pay tomorrow. And the line I like is that you pay tomorrow with interest. And that's what happens. And we have all of these people coming into our office continually. In 2000 and, excuse me, in 1994, we also came up with the structural fingerprint exam. And that's the exam that, excuse me, we've done thousands of times on people of all ages. And it can be done without symptoms. It looks at the biomechanics or the architecture of the human being. It's an examination we perfected, and we're trying to create a national network of doctors who will use this exam because this information is needed by everyone. If your goal is to preserve your structure, and that's everybody's goal, they just don't know how to do it. So you need to have a baseline of where you're starting from. 2004, we started the Concerned Parents of Young Athletes program. And that program was designed to let parents know that every one of your middle and high school athlete children have biomechanical faults. These imbalances lead to problems, lead to injuries, lead to costs. And that's why our new mission is we've added the name Actuary Alex. Actuary Alex is basically saying there is a cost that is going to be attached to this human structure through the course of their lifetime. The cost is money. What's it going to cost for tests? The cost is emotions. When injured, how are you going to do? The cost is disabilities that will occur, pharmaceuticals that will be needed, surgeries that will be needed. There is a cost, and those costs can be dramatically reduced if we understand the imbalances that any one of these young athletes has. We can make recommendations and we can start to reduce those costs and increasing the quality of life. Now, the foundation of this program is a law that I came up with probably 20 years ago, the law of tissue tolerance. It basically says when the loading of a tissue, and a tissue is any tissue, bone, ligament, muscle, tendon, when the loading of a tissue exceeds the capacity of that tissue, compensatory physiological changes occur. And that's when injuries start to develop. And so when the loading of a joint or a tendon or a muscle or a bone is increased due to biomechanical imbalances, the body is already going through its adaptation, its changes. And we don't look for that in our healthcare system or in our sports med system. So therefore, we don't do anything proactively. We wait for the symptoms to come, and it's reactive. So with With this law, it changes how we view patients, it changes how we manage patients, and some of the things written about it, which are really profound. In the field of sports biomechanics and injury prevention, few principles are as fundamental or as overlooked as Dr. Magg's law of tissue tolerance. This law not only reframes the understanding of how injuries occur, but also emphasizes a proactive model of care that stands in stark contrast to the conventional reactive approach. By the time a person feels pain, the underlying tissue has often been compromised for months, if not years. The law of tissue tolerance emphasizes that symptoms are late indicators and not the beginning of a problem. This highlights the importance of proactive assessment and correction long before pain emerges. And that's the whole philosophy that we want to begin to motivate our community, that it's the biomechanical faults that we want to be addressing, not the late coming symptoms. So for years, this isn't a new concept. 2004, we started the Concerned Parents, and that was back when I realized it was an ignored population. Today, the growth of youth sports in the last 21 years, no one could have anticipated. I've told you that private equity firms are investing billions of dollars into youth sports because it's now bigger than the NFL. So we've been writing articles for years here. Imaging is the future of musculoskeletal care, a topic that is a very hot topic in the field of youth sports today. We wrote about high school athletes and structural management. So we've done our best to try to get the message out there. But what is the role of x-rays in youth sports? Now, this is a critical question because most of the industry has no understanding of how to use x-rays with youth sports. They would say you check for a broken bone, you check for scoliosis, and that's about where their list would stop because they don't know anatomy and physiology and sports injuries in the biomechanical world. They know them in the pathology world. Those are the key words that they have. But the role of x-rays in youth sports goes way beyond what they know. And this is the message that I'm trying to get out there. And I want to show you a piece of it so you understand why we want to get every young athlete x-rayed and why we want to manage them through the years with conservative number of x-rays where the information you're getting is far more valuable than the radiation or exposure that we think they're going through. All right, so that's kind of the feeling out there is why x-ray kids if you don't have to. Now, here's a letter written by an orthopedic surgeon out of Illinois and wrote it to the superintendent of a school in Illinois where a doctor who was in my network was doing x-rays as part of a structural fingerprint exam. And I want to read to you what that said. You can see the letter was written in, well, maybe you can't, but it was written in December of 2019. But the letter says volumes. The orthopedic surgeon said, yesterday I met a Plainfield North freshman student and his father. If I understood them correctly, certain student athletes at Plainfield North are sent to a certain chiropractor for screening exams prior to sports participation. This child had, I believe, a normal variant in anatomy seen only on x-ray. He had no symptoms or physical findings that I could discern that would require such radiographs. Still, he was exposed to ionizing radiation. A plan for chiropractic treatment of his benign radiographic difference was also apparently mapped out for him. I know that medical clearance for sports participation is a worthwhile goal, particularly with respect to certain cardiac anomalies and following some injuries. I am unaware of any evidence supporting the value of routine chiropractic evaluation. Wholesale radiography of asymptomatic and normal appearing children with the attendant radiation exposure is very difficult for me to justify. If my understanding of the situation is in error, I would very much appreciate being set straight. Now, what you've got there is someone who has learned a model of care that is reactive. So for him, it's a shock to see that anyone would take an x-ray of an asymptomatic younger person. But when he talks about who looks normal, nowhere in our books does it say that you evaluate a young athlete by looking at them and seeing if they look normal or not. So an x-ray holds the information to the future of an individual the same way blood tests hold that information. So can you imagine the medical community not doing blood tests? So if you have anyone over here looking at the architecture of the human uh, being, looking at the musculoskeletal system that houses the nervous system, don't you think there should be some advanced testing that is going to give you clues before they become injured? And the answer is absolutely. He doesn't know it. His model is the cause of the problem. They encourage reactive care. And we're over here saying, no, change the model. Because in the end, what happens, musculoskeletal is the leading cost in healthcare today. And it's all due to the fact that that model is in charge. And we're over here saying, no, let's start with the youth of today. Let's start with youth athletes who really care about their bodies. And let's start to make changes there, especially in light of the fact last week we talked about overuse injuries. Overuse injuries in the youth athletic population today is enormous. And then you have these doctors that are waiting for the injuries to treat the injuries. So it's so incompatible. It's hard to even comprehend. Now, what do you look at on an x-ray? There's a wealth of information. I said every x-ray tells a story. And when a 12-year-old comes into my office and has never had an injury, is not in pain, I'm excited because I know I'm going to uncover biomechanical faults that will lead to problems down the road. So here we have 118 new patients with orthotics. And we talk about there are two contributors to the height of the hips. One is the collapse of the feet, and two is the length of the leg. So we have 100 new patients that have orthotics. So all we're going to be looking at is the difference in leg length with the x-rays that I'm going to show you. It was between 2017 and 2019. They range in age from 12 to 18 years old. There was 78 boys, 40 girls, one x-ray, front x-ray, where we can look at their hips. Now, normal is 3 millimeters and below. 3 millimeters and below. Abnormal is above 3 millimeters. So in the industry, if they have above 3 millimeter difference, that's when we start to use a lift. And you use a lift to try to get the hips as level as possible. So now, no one has ever done this study, and it's not a formal study, it's an informal study where I've collected so much data, and I wish I had the time to look at, because we have 118 students here. I have data probably somewhere between 2,000 and 3,000 students that would only show you increased numbers of what I'm about to show you. So the first group we're looking at of the 118 were those that we would call normal, where their hips are less than 3 millimeters different. 46 of those students qualified, which means 72 of those students had hip heights greater than 3 millimeters, which means they should have the appropriate lifts put in their shoes to get those hips to be level, because the hips are the most important measurement in the body, because it's the foundation of the spine. And if the hips are unlevel, that spine is sitting on an unlevel foundation. Right and left are working totally different. And we know different areas of the body, muscles, joints, discs, are the weight bearing is misproportioned, leading to premature breakdown. And we know that. Now add to that the overuse of activity and weightlifting, games and practice, and you're going to have a catastrophe as time goes on. 72 are greater. Well, let's get a little more specific. How many are greater than 5 millimeters? And as this number goes up, The imbalances increase, the degree of the potential injuries increase. 43 of 118. How about above 10 millimeters? Well, 12 of the young athletes are above 10 millimeters. How many are above 15 millimeters? And look at the torque in that pelvis. 5 of them. Now, the 118, you cannot externally look at that young athlete and tell which one has an imbalance in the pelvis. The body adapts so creatively, you can't tell. You have to have an x-ray. All right. And the final one, above 20 millimeters, look at the difference in those hip heights, and that was 1. So you say, well, that's only 1 out of 118. Why should we x-ray all of them? Because all of them have a baseline, and that baseline changes over time. And we say either with a growth spurt or every 2 years, we need to retake this x-ray to be able to see what the difference in hip height is, because it changes. And how does it change? Well, I've shown this before. I'll show it again. To the left is a 13-year-old at 6.3 millimeters with orthotics. At 15, he's at 7.7. At 17, he's 10.3. And we can see that if you're not putting the appropriate lift in there, those weight distributions are becoming more and more imbalanced, and they're an injury waiting to happen. Now, this is one measurement. There are multiple measurements biomechanically, and we'll go over them on future podcasts. This is one measurement that we want on every child. So now with our structural fingerprint exam, we can do our 4 x-rays and our full physical exam and get full body information. But we've made it easier too, because now we have the Dr. Mag's leg length test, which says come in, get orthotics, because we know everyone has collapse of the feet, and get 1 x-ray. This x-ray, if you're greater than 3 millimeters, will put a lift under the low hip orthotic. And that will then allow balance of the hips and correction of the feet. And now the weight distribution is much more balanced. Okay. So it's just so important to consider this information with this youth sports population. Okay, so now you say, well, no, we don't want radiation. That's what our orthopedic friend is saying. Every day, hundreds, if not thousands, of CAT scans are done in this country. They're routinely done without any consideration. A CAT scan is the equivalent of 50 low back x-rays. So it seems that it's not that much of a problem when it's ordered by the medical community, and they're ordered routinely every day in every hospital in the country. The amount of exposure from probably 10 x-rays during the years 12 to 18, 12 to 19 is irrelevant, insignificant, relative to the information that you receive and the proactive care that we can perform on a young athlete to help manage it. This is one aspect of the management. I'm trying to show that the x-ray is a critical part of maintaining the health and the injury-free status of these athletes. So the goal is what we see before and what we see after. That's the goal for every young athlete, and each athlete requires different things to get them there, but that's what we're out to do, and we encourage everyone. Please, if you have relatives, if you have neighbors, if you have children, just call, set up an appointment, and at least go through the Dr. Mag's leg length test so that we can balance them, and they'll walk out of here 50% less likely to be injured than when they walked in. And then let's get them into our management cycle, and it's going to change the outcome of their life. Remember, joint replacement is a growth industry in this country because the model follows the information in the letter from the orthopedic surgeon, and we want to kind of change that whole thing. All right. So thanks much. Have a great week, and we will be back next week.